Hello there, Naturopath Nation. Dr. Shoemaker here today to tell you about an herb that is a perfect fit for our stressful times, Astragalus. Astragalus root has been used for several thousands of years in traditional Chinese medicine and is positioned perfectly for our current 2020 global environment because it packs a double punch of both an adaptogenic and an immune-boosting medicinal herb. Adaptogens help the body adapt or modulate to a challenging environment, whether physical stress like extreme temperatures or emotional stress like political trauma or grief. Immune-boosting characteristics of Astragalus can optimize immunity and fight disease, helping you combat sinusitis, strep throat, and viruses like the flu and others. Anything that combats stress and disease and improves immune function should certainly grab our attention this year. Astragalus is a root harvested from a 4-year-old plant and is native to the north and eastern regions of China. Even though there are over 2,000 Astragalus species, we only use 2 medicinally. At Naturopath to Wellness, we use Astragalus membranaceus. Astragalus contains 3 active components most responsible for its heroism: saponins, flavonoids, which you may know as living color, and polysaccharides. These plants are responsible for its ability to improve cell signaling and cellular communication, to optimize cell function, detoxification, and even slow aging. They behave as potent antioxidants to scavenge free radicals that age our bodies and promote disease, like cardiovascular disease, diabetes, kidney disease, and even cancer. Astragalus promotes immune function through its antimicrobial and antiviral properties to treat colds and flus and modulate the immune response. Astragalus optimizes cardiovascular health, has the ability to reduce cholesterol, blood pressure, triglycerides, and exerts anti-inflammatory properties to treat a host of inflammatory conditions from dermatitis to asthma to arthritis. Given these 5 properties, you can see why it fits perfectly with our upcoming high-stress cold and flu season. Astragalus can be used by children and adults alike. It can be found in anything from teas and tinctures to topicals and capsules, and is often blended in stress complexes and immune supplements. An easy way to consume Astragalus without popping another capsule or struggling to tolerate an alcoholic tincture is to get an Astragalus root glycerite. It is easy to take 2 to 3 dropperfuls going out the door in the morning, and the taste is sweet, not offensive. Astragalus can safely be taken for several months in a row, during emotional strain, exhaustion, or overwhelm, or throughout cold and flu season. It can also be saved to use acutely to give short-term boost to immunity when starting to feel sick. If you're looking to specifically reduce stress, Astragalus is often combined with other popular adaptogens like licorice, ginseng, withania, or erythrococcus. And for immune boosting, Astragalus is often blended with other immune-fighting plants like echinacea, golden seal, elderberry, and medicinal mushrooms, to just name a few. When appropriately used, Astragalus appears to be very safe and to have very few side effects. It makes it easy to prescribe to our patients. Studies show that extreme dosing up to 60 grams a day, which is ridiculous, for up to 4 months have been used without reported adverse effects. Some possible side effects with oral use you might look out for is a rash, some itching, maybe nasal symptoms, or stomach discomfort. These are extremely uncommon. Typical dose strategies for Astragalus membranaceus that I recommend at our office is 300 to 600 milligrams 2 to 3 times per day for acute purposes, and lower doses close to 300 milligrams per day over several months. I will often use adaptogens for a window of time, perhaps 3 months, and then rotate and choose another. For children, I would recommend 2 dropperfuls of a liquid, sweet-tasting glycerite 5 or 7 days per week during the cold and flu season or a stressful time in their life. Very high doses may suppress the immune system, so you should avoid Astragalus if you're taking immunosuppressing drugs. And check with your naturopathic doctor if you're nursing or pregnant, or you're diagnosed with or being treated for autoimmune disease, as Astragalus might be contraindicated. When you need a botanical boost that covers both immune stimulation and stress adaptation, think no further than Astragalus. Thanks for tuning in today. Until next time, we hope your family is well.